Just kidding, just kidding. Okay, so you've got your Stockingette on. You've come up here enough where you're over, above, so when you put your casting material on, you can pull all this over and you'll have a little bit of cushion over the actual first layer of casting. Same thing here, probably go a little bit longer, that way when you peel this back over, you'll have enough material to actually add some padding over the first layer of the cast. So for positioning, Dr. Graff or the other doctors will tell you if it's post-op patient, you want to be mindful of the particular surgery that we did. Achilles tendon, we put anchors in the heel here, and so we want this in a relaxed position. We want the foot plantar flex because the anchors are in the bone here, and so you want to be able to have no tension on the actual anchors and the tendon. Otherwise, if you pull it up like this, there's too much tension on here. It can actually pull them down out, but it can also have the healing process take longer because there's too much tension on that. If we do a lateral repair over here, a lot of times Dr. Graff or Dr. Pham or Dr. Kiprios will want the patient in a relaxed position here. Just like here, we're relaxing the Achilles tendon. Over here, we want to relax this here so there's not a lot of tension. So you want to evert the foot, have it everted here. Now, if we do a medial repair, same thing. You're going to want to, invert the foot. And then a lot of times, you want to not necessarily have it in a 90, but if they're going to stand or walk or anything like that, Dr. Graff will tell you go ahead and have them in a little bit of a 90, but still take the tension off of that area that we did the surgery on. So those are a couple things you want to be mindful of when you're putting the cast on. So then you can put your casting material on. You're going to do the cast padding. You're going to do 3 of these first, and then the other things to be mindful of when you're putting your padding on and the areas that you want to pad up are your metatarsal heads, your malleoli, and then the tubercles up here. You want to come right below those. So a lot of times you can feel them on the patients, but after a while you'll get to know exactly where to go on this as far as your leg cast goes. The other thing is patients will sometimes say, "Oh, can you make it shorter?" So you don't want to do a cast that's shorter here, because if they fall, trip, or step down, you can actually snap the leg, the bones in the leg, if it's actually about halfway from the top to the bottom. So when you're putting this on, come this way as far as where your heads of the metatarsals are, and put your padding on here, and you'll want to see I'm coming probably a few centimeters past the metatarsal head here, and you really kind of pad that area up and then start coming up. You also want to pad the heel up here. A lot of times for transfer, patients will actually kind of just step down, put a little bit of pressure on their heel. So you want to make sure this is padded up as well. And as you're coming back up, I'll either have the patient here, or you can have them have their leg rotated off the side of the bed. You want to rotate your leg off a little bit. And then you can come down a little bit and then bring your material. With this cast padding, all this is for is padding and comfort, so you don't have to be pulling tight or anything like that. You just want to lay it on and roll it, and then you'll want to do your other rolls. You want to do the next roll to kind of